In 2011, Nigeria recorded its most significant reported diphtheria outbreak, which affected many in the rural areas of Borno State. 12 years after, the disease has now spread to 20 other states, affecting about 800 persons between December 2022 and now, a figure given by the Nigeria Center for Disease Control and Prevention. The House of Representatives has now urged the Federal Ministry of Health and the NCDC to ensure that the outbreak of diphtheria is contained effectively, as well as reduce the fatality ratio in confirmed cases. With diphtheria being a highly contagious disease to all age groups, especially unimmunized children, lawmakers say there needs to be more efforts in sensitizing the public to take the vaccines to prevent infection. Joining us via Zoom from Abuja is the consultant pediatric infectious disease physician, Federal Medical Center Abuja, Dr. Ndidi Ulodiba. Good morning. Thank you for joining us on TVC Breakfast.
Good morning, and thanks for having me.
Good morning.
Right. Now, let's begin with how it is that 12 years afterwards, we are seeing a rise, a huge rise, in the matter of diphtheria spreading across the country to 20 states. What could have happened?
Well, a lot of factors are in play here, and majorly that's because of the suboptimal vaccine coverage in the nation. That's the main drive for this outbreak. The population that is affected in this outbreak and mainly the children aged 2 to 14 years, and national studies on the diphtheria immunization status done recently showed that the diphtheria immunization status, the antibody status, is actually suboptimal. So we are having suboptimal vaccine coverage. It means a lot of children are either not immunized at all, or they didn't get the complete immunization vaccines needed for immunity to diphtheria. That's the major problem. Another factor contributing to this is still the problem of having suboptimal living conditions, overcrowding. These are some factors that promote the spread of respiratory tract infections, which diphtheria is. So, the major factor actually is the suboptimal vaccine coverage. Diphtheria is a vaccine-preventable infection, but unfortunately, a lot of our people are not, children and adults are not fully immunized, and then we're having this happening now.
All right, make us understand. If the name diphtheria, of course, is not strange, but it may not be as common as malaria and headache that some people might have access to or know on a daily basis. Make us understand what is diphtheria. What is that? And at least, especially for the new generation of people who may not understand what diphtheria is, can you enlighten us what it is and what really causes it?
Diphtheria is an acute bacterial infection. It's a bacterial infection affecting mainly the upper respiratory tract and then the skin of individuals. It's caused by an organism called bacteria. That's the name of the bacteria. And bacteria has different species, and the toxigenic ones, the ones that produce toxins, are the ones that cause the disease, diphtheria. It's highly contagious and it's potentially life-threatening. The name diphtheria actually came from a Greek word diphtheria, which means like a leather or a hide skin, because of the characteristic presentation of this disease in the respiratory tract and affected areas. It usually gives a pseudomembrane, an adherent pseudomembrane in the areas affected, which looks like a leather skin. So that's how the name came up. So it's a bacterial infection affecting the upper respiratory tract and sometimes the skin. The skin is affected usually in tropical areas. but the most common site where diphtheria affects is the upper respiratory tract of individuals. So that has to do with the nose and then the throat. So in a nutshell, that it is. But rarely, on rare occasions, diphtheria can also affect other sites where there are mucous membranes. For instance, the eyes. So the eyes can be affected, the ears, the external ears can be affected, the vulva and vaginal regions can be affected, but this is on rare occasions.
Now, how does it manifest as against common cold or flu? How can people easily identify that actually what they are manifesting is diphtheria?
The presentation is actually similar because it's an upper respiratory tract infection. So it can affect, sometimes it affects just the nose, sometimes it involves the throat, that's the pharynx, the oropharynx, and the nasopharynx, and then sometimes the skin. So it typically will present with a person will have a running nose, and then you may have erosions, ulcers in the nostrils and then the mouth of the affected persons. You can also have fever, malaise, headaches, and then when the throat is involved, there is enlargement of the tonsils. The tonsils are are structures in the throat that can get enlarged, and then the person can have hoarseness of the voice and difficulty or pain in swallowing. Those are the common symptoms. And then it can also progress to involve swelling in the neck. That's what we call bull neck appearance. So the person's neck can get swollen like the neck of a bull. There can also be a noisy breathing, what we call stridor, noisy breathing. Then on examination, the clinicians, when the doctors examine the hallmark of the disease is actually the appearance of those pseudomembranes that I mentioned, which are seen clinically. So it may not be so different from the usual flu presentation, the only mild cases, but the distinguishing factors here are where you have the appearance of that bull neck, when you have the presence of those pseudomembranes. And that is why it's important that anybody with these symptoms of upper respiratory tract infection at a time like this, that we have an epidemic, need to present in the hospital so they can be examined, assessed, and the exact nature of the illness determined.
All right. At what age? At what age will anyone outgrow the capacity to fall victim to diphtheria? It seems to be a disease that is found more among young or children, as the case may be. Make us understand this.
Actually, children are more at risk because generally their immunity is lower, but adults also have diphtheria. So it can happen in adults that were unimmunized, adults that didn't have the vaccines at all, and adults that are also predisposed to other risk factors. For instance, adults that are immunocompromised, adults that are living in overcrowded or suboptimal living conditions, they can still come down with diphtheria. So adults can be affected, but children are more at risk because of their lower immunity.
So at what point does it become severe? Because there are reports that it could lead to paralysis and some other complicated issues. Could you speak to us on that?
Yes, it can become severe or complicated when it presents with complications. So the complications of diphtheria include upper airway obstruction. Because of the inflammation in the upper airway, there is swelling, and the airway can be narrowed, and there can be airway obstruction leading to respiratory failure, which is a fatal situation. So it can present that way, and then it can because the organism elaborates toxins, the toxins can affect even the heart, leading to some abnormalities in the heart, which can range from what we call myocarditis, inflammation of the muscles of the heart. It can be rhythm disturbances, what we call arrhythmias, heart blocks, because of the effect of the toxin in the heart. It can present in heart failure. So these are life-threatening presentations. It can even affect the nerves, both the peripheral nerves and the cranial nerves, resulting in diverse manifestations. So the kidneys can also be affected and can cause what we call acute tubular necrosis, resulting in an acute kidney injury. And this set of patients may need dialysis to sort out these complications.
Really good to know. Is it curable? Anyone who is not maybe vaccinated but comes down with diphtheria and is known, is it curable?
Yes. But the key factor here is early diagnosis and prompt initiation of treatment. We have treatment protocols, and the specific treatment for diphtheria is actually the use of antibiotics. We have antibiotics that we use for treating diphtheria, and if the patients are detected on time, if they present early and a diagnosis is made, and these antibiotics are commenced on time, they do well. But when there is a problem of late presentation, we tend to have high case fatality rates. So apart from the antibiotics, there are other measures that are also put in place to take care of these patients. We do supportive measures, supportive treatment, and we also manage the complications. They are usually nursed in isolation because of the highly contagious nature of this infection. We also do contact tracing to identify other people that have been exposed that are at risk of coming down with the disease, and it's a notifiable disease. So in the management, we don't just take care of the organism, we also take care of other aspects that are vital and very important. So with the prompt initiation of treatment, and supportive care, attending to the diverse complications and presentations, they do well. But there are some other factors that can also worsen what we call the prognosis or the likelihood of survival. And this would include the person's baseline immunity or immunization status, and then the site of the disease, the time of presentation, the time of commencement of treatment. These are factors that can actually affect the outcome. But with early presentation, we do have better outcomes.
Right. Now, is it possible to prevent? Is there a possibility for prevention aside immunization? What other ways can people ensure that they keep themselves from being, since you said it's a communicable disease, how they can ensure that they avoid being coming down with this infection, basically?
There are general health preventive strategies, and then the specifics. The specifics, like you mentioned, is the specific prevention is the vaccination, and that is so important. I would like to emphasize that first, because we still have a problem of suboptimal vaccine coverage in our environment. Even in the FCT in Abuja, the vaccine coverage is suboptimal. So as part of the strategies by the NCDC and Federal Ministry of Health that are going on right now, it's the emphasis is on maximizing immunization. So a lot of immunization campaigns are going on. Booster doses and mop-up immunization is going on for people that have not been immunized and those that are incompletely immunized. So that is the very specific preventive measure. Then in terms of general prevention, health education is one, and I'm really happy about what TVC is doing. You're creating awareness already, and this will go a long way in helping people. When people are informed, they'll be able to present early, and then the cases will be identified early, and prompt management started, and contacts also identified and managed. So health education is one other preventive measure. Another general preventive measure is avoiding overcrowding. Respiratory tract infections generally spread through respiratory droplets. That's how the disease is contacted. So when there's overcrowding and poor ventilation, it creates a big problem. So that is one factor that needs to be considered. Proper ventilation, good housing conditions. Okay.
All right, we'll leave the conversation here now. Dr. Ndidi Uloduba, a consultant, pediatric infectious disease physician, Federal Medical Center, Abuja. Thank you for your time on the program.